and welcome to Ask the Doctor. My name's Jerry McGee and I'll be your host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. On today's episode, we want to talk about a problem called plantar fasciitis, and we kind of have a little catchy phrase for this. It's when your heel bone becomes your hell bone.
That's pretty good.
That's our title for today's episode, and because really it is the truth. This plantar fasciitis, although it's not really necessarily a major problem, can really be a debilitating problem.
I understand it hurts like hell because you get up from bed and your muscles are real tight because you haven't used them for 8 hours, and as soon as you take that first step, that's when you feel the pain. Now the good news is, the more you move around, it loosens up, you stretch it out. We have stretching exercises we give our patients, and then by as the day progresses, it starts to loosen up and it's better. Mm-hmm. And usually it's from inflammation, and it's in the deep muscle layers, which is the fascia. Okay, so we can work on that. We can do trigger point therapy. We can do physical therapy. Biofreeze is very good. Also relates to fallen arches by putting an orthotic in there or a lift on that side. Sometimes it relates to the hips, the pelvis, the low back. They actually have a short leg on that side. Sometimes they have a thing that's called pronation, where the foot actually rotates medially, and that puts a tremendous amount of stress on the lower extremity. Okay, so it's kind of like the kinetic chain, the domino effect. It's like it's all connected in there. It's like one single synchronized functioning unit. And then the effect is you take a step in the morning and you have extreme pain. And so, of course, they come in the office and we address that 9 times out of 10. Mm-hmm.
Yeah, I think, as people are watching this today, I mean, what is something that, what are some of the signs and symptoms, per se, kind of, what's the, is it like a sudden thing that just comes on, or how is that?
Usually it's from repetitive use, like if you're a runner, if you have poor shoes, you don't have the support. Sometimes pregnant women even get it, okay? So it's usually something you do in your life, okay? So of course we live in a cause and effect universe, so if you're a runner and you keep pounding on cement, of course that's going to traumatize the foot, the lower extremity, and you're going to get inflammation. Okay, in fact, there's a theory inflammation is behind all disease, whether it's plantar fasciitis or whatever it is. Okay, so when they take that first step, they have tremendous pain. So we give them stretching exercises. We use biofreeze. We put a lift in the shoe. We use an orthotic, and it's all good. It all works. We can even use an instrument called the impulse, which stimulates the mechanoreceptors in your brain, which modulates the pain tremendously. So it's all good. It all works, Jerry. We do anything and everything we can.
Now, when we talk about repetitive action, I think it's important for our viewers to understand that repetitive action that causes this problem can be related to a lot of things.
Running, number one.
Right, could be running, could be, say, a work-related almost, where they're doing the same thing, maybe standing on
standing.
On a hard surface.
Standing is bad all day.
Yeah.
If you stand all day on a hard surface and you have fallen arches, you're in trouble.
Mm-hmm. Yeah, I think we've seen a lot in the workplace, a lot of talk about the ergonomics, making some changes to the workplace, simple things that that can help. But I think one of the things that, from talking to some people and doing some research, that I think people want to avoid at all costs is when you start to feel this problem, that's when you want to start the treatment.
Nip it in the bud.
Right. It's not something where you kind of like, I'll work through it, and all of a sudden it gets to the point where you're really laid up at that point.
My comment on that is, if you wait, the longer you wait, the worse it's going to get. Mm-hmm. Over a period of months, I've seen people, wait 6 months. They're basket cases.
Yeah.
So if you're going to have it, get it in the first month. Otherwise, it's going to get worse. Like anything's going to get worse.
Yeah. I think one of the other key things also is people look at any of these problems that we talk about. I think we have a kind of a common theme to all of them. One, early intervention is important. Even getting some basic kind of maintenance checkups throughout the year. We've talked about this where people will go to a dentist for prevention and all that kind of stuff, but they don't really think about coming to a chiropractor, which you really should, to make sure the body's in proper alignment, functioning correctly. And those little simple modifications through the year can avoid a lot of these issues.
See, I ask people this question. I put them on the spot. I say, Susie, what's more important, your teeth or your spine? You get your teeth checked every 6 months. You get your spine checked every 6 months. Who's your chiropractor? Mm-hmm. She doesn't do it. See, to me, your spine is more important than your teeth. You can get false teeth, Jerry. You can't get a false spine. Yeah. So to me, getting your spine checked every 6 months is just as important, if not more important, than getting your teeth checked.
Mm-hmm. Yeah, I think that's, understanding that key point can help alleviate a lot of the problems that we have. I mean, we've been, and I think some of it's been the training that we've been brought up with. The marketing and all that kind of stuff, how everybody's kind of used to dealing with some things, popping some over-the-counter pills. Yep. Okay, that's not working. Now I'm going to go to go to my family doctor. He's going to give me a stronger medication. that I got to get for a prescription. Nobody ever treats the cause.
Right.
They all treat just what the what the symptoms are.
Right.
And what I always loved about what you guys do down here is you really work to get to the root cause of the problem. And a lot of times, as you said, it doesn't. We can look right at the heel, but we also have to look up the leg, into the low back, and make sure, because you can treat that low problem, but if you don't fix the problem, say in your hip, and you have that short leg problem, that problem's going to come back.
When you're a little kid, did you ever play dominoes?
Mm-hmm.
You knock over the one domino, it's like your lower extremity. It's the domino effect. It's the kinetic chain. The hip, pelvis, low back, affects your knees, affects your heels, affects your feet. It's all connected. See, we as chiropractors, Jerry, we say your low back affects your feet. Now, podiatrist I know, he says your feet affects your low back. You know who's right? Both of us.
Right.
You need both.
Now, when you had talked about orthotics, because I know a lot of people recommend orthotics, you do that?
Yes, we do.
Right here.
We send it down into Virginia. It's called foot levelers, and they do a mold, and then they send it back, and we just slide that right in the shoe.
Okay.
A lot of times your insurance can cover it.
Mm-hmm.
Okay, so that's all good. It all works.
Now, when you look at say a treatment duration on this, like in your experience, what would you say would be a normal kind of course of action? Is it a long recovery period? Does it vary case to case? What is the kind of the duration?
My understanding is, for usually rule of thumb, if we're treating somebody 3 weeks and they're not at least 40% better, then I refer them out. So whether it's your low back, hips, pelvis, your knees, your feet, I want you at least 40% better after 3 weeks. We use that as sort of a gauge. So usually if somebody comes in 9 times out of 10, we want them at least 40% better, no matter what it is after the first 3 weeks.
Okay. And right there is kind of, I think, a key phrase that you said. You're going to treat it the way you know how to do that. However, if you're noticing that you're not getting the improvement that you wish, you don't have a problem saying, okay, we're going to refer this out, get another opinion, maybe do some further testing, whatever is needed at that point. That, in my opinion, is a very unique concept in the medical profession because it doesn't happen a lot of times.
See, I call that change the prescription. So if you're doing something and that's not working, if you're taking an antibiotic ABC and it's not working after 2-3 weeks, wouldn't you want to go to XYZ? Mm-hmm. So it's same with this office. We're given a prescription. It's a chiropractic prescription, physical therapy, nutrition, exercises. If that works, great. If it's not, then we change the prescription. We refer them to something else, to somebody else that can help. More brains that we can help you, the better.
Mm-hmm. And really, that's one of the things that we want to stress to everybody viewing here is you come down into this office. That's the approach that you're going to get for all your problems. It's a total body, holistic approach with also the implementation of using other health professionals when needed. It's just really looking out for your best interest. So, with that, we appreciate you watching our little short presentation today on plantar fasciitis. If you're dealing with that problem or, are having those little aches and pains in your heel, don't put it off. Pick up the phone. The number's right here on the video. Call Dr. Goldberg down here at Wellness Associates. Set up an appointment. Come on down. Let him show you firsthand what he can do and the expertise that he brings to this field. And we just really appreciate you watching the video. Check out our Wellness TV channel here for some upcoming great episodes this month. We're going to be dealing with cholesterol and heart disease, weight loss, total body modification, and tennis elbow this month. Things that affect a lot of people out there. So hope you enjoyed the video, and we look forward to seeing you on our next episode.